And welcome to another edition of Heart to Heart. Heart to Heart is where we share stories of breakthrough. My name is Elmira. I am your host. We gather here every week to tell stories of breakthrough. Today's discussion is mental health history. We will have our guest, Fatima Denga, to kind of give some insight into this based on her own personal story. I will tell you, this conversation was catapulted by it has a little story behind it. I had watched this presentation, well, an interview from 19 Keys. This was probably almost a couple of months ago, maybe about a month and a half ago, and he had this therapist on, and she was kind of making some strong claims and things about mental health is overused and people may not actually need therapy today. I mean, she has her own thoughts, her own beliefs and everything, but the deal is we need therapy. We need therapy more than ever, and that's how Fatima and I got on this particular conversation back and forth. We were saying, yeah, this is it. But what is the history? Why do we need therapy? Why do we need these things? What makes therapy more important now than ever? Because we're right now in, we would call them modern times, and we don't have a lot of the systems that we had thousands of years ago, where it was very communal. I can say this for myself. I remember growing up, I was born in 1978. So I grew up in the 80s and the 90s. And we had a lot of people in my neighborhood, and I lived in a rural neighborhood. I could go visit. Plus, we lived with my grandmother. I actually lived with both grandmothers on my dad's side. And then once I moved at the age of 5 to my grandparents' home, this was after my grandfather's death. I never got to meet him in person. Moved in with my grandmother. So that family community was so strong. I grew up next to all of my aunts, lots of cousins, went to the church with other extended family members, and that community was so strong. Not my family community, but just the community at large, what you participated in at school, who you might see at the grocery store. It was just more of a communal feeling. So imagine if that could have shifted from 40 years ago. How were we living prior to then? How was our mental health? Because of this community, we were surrounded by people all the time. Now we live alone. I can attest to this myself. I've lived away from family since 2011. And that was my choice because I wanted to expand, I wanted to grow. And due to those, that's some of the reasons. Let me see, we may not actually, because I think she got the time mixed up. So we may need to reschedule. Um, Let me see. But I'm going to stay on just in the event. And if not, we will reconvene and see what happens. But let me just continue this discussion about mental health. My own mental health is, I can say years ago, hold on, I think she's here now. It takes a little while. I see you there, Fatima. No worries, no worries. There you are. Hey, how you doing? Doing pretty good. How about yourself?
I'm good. I messed up the time initially, so I had to
But
quickly dash to school to pick up my daughter.
oh, it's okay. It's okay. But springtime, that happens because there in the UK, y'all change times different than we do. So for a period of time, it's wonky.
Well, that's what happened. When I checked this, it was winter time, but now
Yep.
we're in
Yep.
summertime.
That's what happened. It
Had to
happened to
change
me before.
location,
So
put myself in the kitchen because she would just make noise if I sit, you know, where I usually do this. So it's fine as long
yeah,
as you can hear me.
it's all good. Well, before you came on, I was kind of talking about mental health. And one of the things I was stating was how I grew up. And we used to have this community. Like I grew up around a lot of family. And that's one of the things you mentioned, because this discussion is kind of like, why do we need therapy? Why do we need what's going on with mental health and the history of it and where we are going, where we are right now? What's one of the things you've seen in your history about mental health and why we need it more now than ever?
Well, interestingly, I grew up similar to you. So I grew up in Zimbabwe and in African communities, African families, community is a big thing. And it means you've got more people to support you. However, we have now become very westernized, which means we are now people who are also part of the whole, I call it the capitalist treadmill, which, it's all go, go, go. So what does that mean? You are concentrating on yourself.
Mm-hmm.
But I don't believe that we were meant to live as individuals without support. And I think that's probably why there's been such a big surge in mental health becoming such a front line in our lives, becoming a problem. Because people are isolated. They don't have anyone to support them. And I've experienced it as well as a migrant. I came to the UK at the age of 18, and I can tell you that the first year of my life was not necessarily the first year, because the first 6 months I stayed with my with an auntie and
Mm-hmm.
family. So nothing seemed different. I just traded hands from my mum's house to my aunt's house, who I still treated like family because that's how we grew up. Your aunts are like your mums. But when I went to university, that year was awful. I suddenly
Hmm.
realized I'm alone. I don't have anyone.
What did that feel like? What did it feel like?
It was lonely. It was tough. And it was just, I was also studying in a foreign country. I'm trying to get used to being in a new land, new ways of being, new ways of seeing myself. I'm 18, I'm an adult in a new country. I've never ever lived on my own before, but suddenly I have to know how to do it. I have to make decisions on my own in a foreign land with foreign people with no support system. That was tough. I can tell you that. And I was down. I remember visiting a doctor and telling him how I felt. And 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 when I say this to people, they always say to me, "That is so unusual." Because I say to him, "I feel so depressed. I'm just sad." Then he started to ask me questions about my life. And I told him how I missed my family, how I missed my community. And then at the end, he said to me, "I don't think you're depressed. I think you need to go home and see your family. When you come back,
Mm.
different, you'll be better." And when I say this so I'm saying this as an African, and I say this to English people, they all say to me, "That's strange, you didn't put you on antidepressants. We get put on antidepressants just like that. But he told you to go home." And I said, "Yeah, he did. He told me to go home." And I said, when I went home, it was like the reset I needed. I did actually come back better. I was fine.
So how
And I never went on
long did it
antidepressants.
you say that
I
again?
never went on antidepressants. Yeah.
This is fascinating to me because what you did too was compare the people who grew up in the UK and that was their country of descent. They're like, this is strange. I would have been put on antidepressants. Why did the doctor tell you? What do you think that doctor knew or could sense or?
Well, if what they do is because I'm a nurse as well by profession.
Mm-hmm.
So and I've worked with the same doctors, so I understand the tests that they use. So it's called, it's something like where you assess if someone is depressed. Now, when I look back at it and I look at the questions that he asked me, I didn't score high enough on the basis that everything I said was tied to, oh, if I saw my family, if I saw my community, actually, I know I'll feel okay. I'm not suicidal. I'm not, you know, it's not that bad. I just miss my family. So I didn't score high. Whereas if someone lives in this country in UK, they're probably already saying, I have my family, but I feel awful every day. So
Oh,
they score higher, which is an indicator to say they should at least start a low dose antidepressant. So at that time when they were saying, well, we've never been told to go to your family. And I'm thinking, no, for me, there was a factor that was missing. And he recognized that, oh, perhaps if that's brought in, she'll be okay. And actually it did work.
because how long did you, thinking back then, how long did you actually stay? Was it for some months
No, I
or?
went for a month because I was studying, so I could only get like a month off. But that month was like the reset I needed, because I came back and just did 18 months of my university course, which was nursing, and finished.
Mm-hmm.
But that month was just perfect. That's all I needed. I was lonely, I was isolated, I didn't have my support system with me, and seeing them was like, oh. And I think there's something about safety as well that probably I needed to feel safe, and I needed that sense of belonging, and being away from my community made me feel like, oh, you're not belonging, you're not safe, or you've got no one. And it probably drove my isolation and my loneliness, like to a depth, like to a height that maybe it wouldn't have been had I been surrounded by family and community.
Hmm. Yeah, this is big. Now you study, you're a nurse, all of these grand things you went on to do. What correlation have you seen between some physical ailments in people and the mental, what they're dealing with mentally? And you may take it back to this community piece and what have you noticed over the years? Have you noticed a shift? Has it all been consistent? People, what you're treating them with physically and how they're dealing with their mental capacity.
So I would probably say I've seen a variety of things. So there were particular people that in the medical community are called heart sink. It's not a nice term, but when they come in, you're like, oh, they make my heart sink. They literally have that. They're lonely, they don't have any support, and they just can't express that I'm lonely and I'm isolated. So what they then do is keep coming to see medical professionals with conditions, because that's their only thing that I don't want to generalize, but there's some that we're known that they come in with the condition every day, or into your, I don't know I think, what do you call accident and emergency in the United States? Like
Yeah.
emergency rooms, ER. Yes,
We
that's
just call it that.
Yes,
Yeah.
there's people
Hmm.
who come and sit in what's similar to ER in the UK just to say I can't breathe, but you know that they're just lonely. They need to be around people. You tell them to sit, they'll sit the whole day, and they don't come back to the desk to say I can't breathe. By the end of the day, they go home. They just needed company. They needed to be around people because they don't have anyone. they're isolated, they don't have community, they don't have things to do. So what they need is company. And those particular people, when they're very isolated, they tend to have more symptoms and they'll come and see the doctor and go, I can't breathe, I'm struggling. I think it's coupled with being a bit anxious. That,
Hmm.
yes. And you'd be thinking, this is so strange. There is nothing to indicate why they're not well or why they're not responding to treatment. Their physical ailment. But for some reason, I think the moment they see me every day, they're better. Because I
Wow.
think I'm touching their soul. I'm speaking to them, to the person, I'm meet, as a healthcare professional, I'm able to meet their need, which is a bit of company, someone to talk to.
Wow.
Which is why,
So,
when you put this topic, talking therapies so therapy is healing.
hmm.
Physical therapy, speech and language therapy. So therapy is basically healing, is treatment. But when we're talking about therapy, talking therapies is what is called in England. It means that you are talking to someone who has a need, which is either mental, emotional, psychological, psychosocial, spiritual, to give them hope and help their healing or provide wellness or give them tools so that they can better live with whatever condition they have. Perhaps they struggle with depression, or maybe they've gone through grief and can't speak what they feel. And they need someone to give them the tools through talking therapies to feel better, to cope.
Hmm.
Yes.
What's been your experience with the talking therapies, whether personal or with other people?
So I did a course on, so my background, so my faith, I grew up Christian. So I
Hmm.
did foundational counseling in Christian counseling course to learn why people need talking therapies. However, after I had my daughter, after the COVID lockdown, I was back to being lonely and isolated. It was awful. And after that, I was just like, there's just something wrong with me. I just feel hopeless. I can't, I don't know what's wrong with me. I'm struggling here. So I spoke to my doctor and I said how I was feeling. And the doctor said a lot of people who had children during this COVID lockdown lost the opportunity to meet other mums, to have services that were naturally open and provided, or routinely open and provided. They couldn't access them, and you became isolated at home. And a lot of you is the pressure, the overwhelm on your own that you're feeling. So I will refer you for talking therapies. And I got referred for that. And it was so helpful because I had someone who listened to me without judging.
Hmm.
And just being listened to without being judged was so, it did something for me. And I think, how we're talking about this, we're talking about how I've seen communities and whether communities are good or not. I don't knock down therapy. The reason being, in my community, because we're so used to being strong for each other, when you now face a time in your life where you are really struggling, no one really knows what to do with you, or no one understands. So you can't be vulnerable openly to say what you're feeling. And even if you are, I remember like people going, especially being raised, religious, there's a way that they put dismiss, I'll probably say, when you say, oh, I'm really struggling, they just kind of have this way of, oh, just pray, it will go away.
I've heard that before.
Yes.
I mean,
Yes. Or so I think now I think the term is called spiritual bypassing. And I found that I wasn't really getting anywhere when I was trying to pray, because what I wasn't doing was actually going to how I was truly feeling, or some of the things that I had gone through. So some of the trauma of having a child during this whole scary phase of lockdown, there's this virus, you could all not be alive, you know, and just the trauma of childbirth and being pregnant, the
Hmm.
hormonal changes. I wasn't accessing services because they were closed. So in my community, no one could help me. And in my religious community, yes, prayer was fine, but there's some physiological things that are also taking place. And no one understands that. And I just wasn't getting any better until I finally had this person to talk to. So by not judging, by listening to me,
Hmm.
not judging, and actually validating that, of course, having a child in such a time is difficult. Of course, it's not normal. The world never had a shutdown before. Of course, you were on your own. Of course, I had 5-minute showers every day because of having a young child who's crying. If you try and shower when they're sleeping, you've got other things to do. It's like, no. And it was just what I needed. And then she then said, these are the tools to help you. You've got to acknowledge, first of all, that you are a mum. It's not easy. You're a new mom, you've never experienced this before. So of course you won't know what every day is going to be like. So you've got to take each day as it comes. You've got to put away the perfectionism. I didn't realize I was a perfectionist. I was.
Yeah.
But then they can nudge you with little statements to say, oh, you seem like you like things to be perfect. And that's what I probably appreciate about professional therapy, because they do know certain patterns, certain traits, they can ask certain questions. And also the thing about the cultural thing. In my culture, women were giving birth in big communities, supported. Hence,
Hmm.
they seemed like superwomen. I didn't have that. So I'm comparing myself to a standard that doesn't match my reality. And the professional therapist could say to me, well, you're not in Zimbabwe. You don't have the village that supported you or supported your mom or your grandmother. You're on your own.
Yeah.
So how can you expect yourself to be like them? You're saying that your grandmother helped your mom to look after you. Um, you're saying that neighbors, aunts, uncles, you don't have that. And what you do have is now and again your family chipping in, but they are also very busy. Their lives are different. So there was a way of bringing me back to reality as well, to really understand that, oh, this is the picture.
Yeah, so not only, Fatima, did you deal with becoming a mother for the first time, there were some aspects to that as well. You were doing it in the height of COVID, where the whole world was shut down. You were also doing it in a different environment than your mom or your grandmother grew up in Zimbabwe. So you had all these other factors, and it was therapy that helped you get grounded and to see, oh my gosh, no wonder I'm feeling lonely or this or like I'm overwhelmed. It was a lot. That's a
Yes,
lot to deal with.
yes.
What do you think about people who may not recognize that things have changed? For example, I just want to give an example. They don't give credence to the fact that, oh, I'm living in 2025, 2026, whatever. And they just said, oh, my life is bad. But they forget that I'm not around that community, or this is not similar to 1982 or 1999. Because I can say here in the United States, and it's probably in the UK as well, prices for food have gone up tremendously. Prices to purchase a house has gone up tremendously. When you compare it to what it cost before, percentage wise of your income, it's increased. So, what do you say to the person who hasn't had that grounding? How do they get a reality check? Like,
I'm going to ask them. I think actually, before I even answer that question, something dropped in my mind, which is insanity is doing the same things every day and expecting different results. If you want to see a change in your life, but you're struggling, but you continue to think the same way, do things the same way, have the same beliefs, you're not going to see changes in your life. So you've got to ask yourself then, if you are still wanting to live like you lived in 1982, but you know that we're in 2025, you've got to ask yourself, do you really want your life to change? Or you like the idea of your life changing, but yet you will not embrace what is required to change? Because as you were saying that, I was just thinking about how, you've got the old buildings with the old structure that are historical in the United Kingdom. They're graded. There are some buildings that can't be destroyed on the outside because they are part of history. They've got to a point now where they realize that some of them, if you don't go and do restorative work, they're going to collapse because their foundations can't hold them anymore. They were built years ago. And they
yeah,
said, we've got to find someone who can restore it to more of the original. However, when you get inside the building, it's modernized because most of the structures inside, for some of them, have fallen apart and they can't keep them that way. So they have to change the inside but keep the outside.
wow.
If you get where what I'm trying to say,
Yeah,
which means that you're
yeah.
still you from 1982, whatever it
Hey,
is.
little lady, I see you. What's going on?
Thank you. I'll see you later. Yeah. So, but then what happens is you're still you, but even if you're still you don't have the same stamina, the same strength that you had in 1982. You've even changed. You need some upgrades. Same thing, your belief systems need an upgrade. If your life's not changing, what's wrong in going to see someone to talk about some of the upgrades to your life? Hold on.
Hmm.
Just hold on. I've
Oh,
got
yeah,
someone
go
saying that they
ahead.
are.
Yeah. I just, as you're doing that, want to highlight what you said about upgrades to your life, because this is good as you compare it to these buildings that
Mhm.
needed to be refurbished. That's what we need as well. And the talk therapy
Mhm.
helps with that, because
Mhm.
what is wrong with going to see somebody to discuss the upgrades of your life, like the shifts, the changes, the growths? Why am I feeling this way? I never felt this way before. What's going on? I didn't feel this way 5 years ago. And they have that outside perspective to see.
It's the same thing. I told you I am a nurse. It doesn't make sense if someone comes to see a doctor and says, "Oh, I've got an ailment." And the doctor says, "You know something? We actually need to change your knee." And they go, "Oh, no, don't do that. I want to keep the same one. But yet I'm struggling to walk." And I'm saying, 5 years from now, you won't even be able to walk on it. You have worn off the cartilage and the joints won't work. It doesn't make sense, but people have that. However, I understand why, because the history of therapy has been tied to, oh, she's seeing a shrink, he's seeing a shrink, to craziness. And perhaps
Hmm.
people don't want to have the stigma associated with that. Like, oh, there's a stigma to mental illness. People will not take you seriously. People will think you're crazy. People will think, oh, you are psychologically something's wrong with you. So perhaps that's why people wouldn't admit or want to see a therapist, because they want to look like they have it all together. They don't struggle. Because when you don't struggle, people take you as, oh, you're strong. I can imagine it's even harder for males. Oh, I'm an alpha male.
Oh,
I
yeah.
don't need anyone to tell me how to run or lead my life.
Yeah. Yeah, men in therapy, and I've, just in the past 10 years, 20 years, or whatever, there's been many men coming out speaking and saying, I'm seeing a therapist, or I saw a therapist, or I consulted a therapist
Mhm,
when this happened in my life. And they also talk about the benefits of it, like what they got from going to therapy as well. Because I know this, yeah, I know this one guy. I went to the gym with him.
mhm,
He specifically helps men and boys. His name is Eric. Like he specifically helps men, boys, and sometimes he talks to the mothers as well. Because sometimes these boys have a single mom
mhm,
as their parent,
mhm.
and yeah.
Yes, I was listening to the podcast. I think Diary of a CEO, just happened to watch it. It came off on its own. That America's Got Talent judge talking about he had therapy later in life, and it was the best thing ever. Finally, he was able to let go of control, and now he actually enjoys his life.
Hmm.
And I thought that's funny because he is the type of man who would have been like, "Oh, I'm an alpha male. I don't need this." But then going off on a little tangent. In the Black community, I found as well, especially from the African culture, there's a distrust of trusting like therapists because we've always trusted our communities. We want to keep and uphold our culture because that's our identity. And from that, we get a sense of belonging and safety. And when someone goes to therapy, the fear is they're going to indoctrinate you with ideas that don't fit the culture, that don't fit your upbringing. So that's one of the reasons why some people will avoid it for that reason. I'll give you an example. When I went to talking therapies for myself, and one of my challenges, which was quite like a cultural issue, the therapist had to say to me, you've got to choose. Either you make the culture happy, but you're struggling and you're suffering inside, you're so miserable, you get to a point of having a breakdown, or you choose yourself and you say, I can't do this. I'm not doing that. I am not living my life this way. But then you become better and you get to actually enjoy your life, your days. And it was fascinating because then I went, oh, I never thought of that. So that's another angle that I've seen, that therapy is quite good because when someone doesn't know you, they can ask you these probing questions, just to probe. And they're built like to challenge your mindset and try and see and unearth like what your beliefs are, what your fears are. Because usually it's our fears that block us to move forward with the things that we actually want. So on the other side, and she gave me a beautiful analogy. I remember she said to me, so what you're afraid of is maybe if you start thinking differently or doing things a little bit differently, then you won't fit in with your family, let's say. And it's like you're looking at a door that's a little bit open, it's not shut, but you don't know what's behind that door. And you decide to say, I will not venture and look behind that door because what if then I'm disowned? She went, but you could slowly move that door open, slowly do it until well, I've opened the room. Oh, and this is what's inside. Nothing to be afraid of. She's like, you could see it that way. went, oh, yeah, true. She said, well, if you go through that door, the other room is still there. You can still come back to it. And I went, oh, yeah, that's true, you know. And that's what really helped me because I just unearthed quite a few fears I had, which were to do with belonging. But then again, it was taking me back to the time when I said I was a migrant in university, feeling very lonely and isolated. And now suddenly I feel like, oh, I'm around family. Oh, but I'm struggling in these areas. I don't know what to say. I don't know if I try and talk to them, they don't really get it. Oh, I don't want to lose them. I don't want to be lonely and isolated again. So it was so interesting because there was a history to maybe the resistance that I had to
Yeah.
change I wanted. So that's where therapy helped me because as she probed and challenged me, I didn't know her. We're not related. So there was nothing for me to be subjective about and take it personally. I have to just be objective and go, oh, she's bringing this example to help me.
Yeah.
And I think that's why I always say I think everybody should have therapy because your therapist doesn't know you. They're only trying to get you to where you want. Because you probably come in and say to them, I struggle in this area, I struggle in this area, I struggle with that. Oh, so what would you want? You tell them what you want. And what they then do is to try and talk you through some of the beliefs that you have, unearth some of your fears, figure out if there's any resistances, what are the things that are holding you back, and try and help you move forward. And also try and get you to see reality.
Yeah, for sure. But that history has a big bearing. And one of the things that came to mind as you were discussing this, because you said, do you choose your culture or do you choose yourself? I've
Mhm.
similar as you. I felt like I may not fit in if I start earning too much money. I start to grow my business to a certain way. I've had struggles with that because I moved away from my family specifically. And I've had, just as you were describing all of these things, I'm like, yeah, I've been there. I've been there. I've been there. Like, felt like I didn't belong because I started to do different things, speak differently, access to this course or this whatever have you. Could, and it brought to mind this question: could therapy in this way be seen as individualism? You know, we talked about the difference between community and individualism, and because we're African Black communities, we're big on, and I would argue that most people are that way. We love community.
Oh,
Could therapy, going to talk to somebody, being seen as you don't want to be part of the community because you're trying to be better than us?
I'll be very honest and say, yes, it could be seen that way. It could be because before therapy, you didn't go to one therapist. You had community kind of like therapy. You probably sat with your elders who then told you what to do, like mapped out
Mm,
you the advice that you should have. But if you look, it was probably what was good for the group, what was good for the community. It wasn't for the individual, never. But then I don't blame people for maybe looking and thinking, oh, I don't like therapy for that reason, because the shift that we've gone from community living to this very sort of like Western capitalist, individualized kind of society, unfortunately, is the new reality. People don't want to live in the villages anyway. If you think about it, some will go back to that. But most people, they want to better their lives, so they are going to move to cities. And what does the city require you to do? To go and get a job, to buy your own house. Because before, we were talking about this with a friend, you never left your parents' house if you didn't get married. You lived
mm,
there until you died. And it was normal. But now, if you're a certain age, oh, and you still live at home, oh, they still live at home with their parents. So in on sort of like in one way, we expect people to show signs of growth and maturity and responsibility and accountability for their lives by having jobs, by purchasing their own cars, their own houses, and that's okay. But if they start having their own individual thoughts that are different from the community they're coming from, suddenly, oh, that threatens us. There must be something wrong then. Because if once someone tastes the freedom of independent thought, thinking, decision making, so for example, I've gone to university to do the course that I want to do, to get the job that I want to get, to live in the city that I want to live in, to buy the car that I want, to buy the house that I want to buy, or whatever. You not necessarily buy a house, but to rent in a place that I want to live in. How
Mm-hmm.
do you then say they don't have the freedom to decide the life that they want to live? How can you say that that's not okay? Because at the same time, you've got, especially in African communities, they want you all to have good careers. Because we're coming from survival, we're not allowed to have these things in the past. Suddenly now, it's okay for us to become doctors, to, as you said, to earn a lot of money, right? They want us to do that. They want us to go to a Western country because it's a sign of what's the word I'm looking for? Not necessarily wealth, but it's a sign of achievement
Mm.
that you have got a degree from the United States, from the United Kingdom, or you've achieved in life. It's a sign of accomplishment. So what was impossible for our grandparents, you're able to do. But with that accomplishment of that, path of getting that degree, going to a Western country, it's a form of becoming an individual. They're not going to be exposed to what grandparents were exposed to or what parents were exposed to. They're going to be exposed to completely new and different things and different ways of living life. And what does that do with exposure? Choices, different choices to live your life.
Yeah. What do you, because one thing that just came to me is your daughter. So we speak of these generations. What are some of the things you witness with your daughter that she'll be able to experience, achievement, experience, opportunity wise, that maybe you didn't have?
Okay, so I came as a migrant. She's born in United Kingdom, so she will not see herself the same way as me, because she'll probably think, I just always grew up here. That's the paradigm I have of life in the UK. So when I take her to Zimbabwe, it will probably be initially be quite foreign to her. She might understand the language, but the way of life will completely be different for her, because that's not her way of life in the UK. But I noticed something about children born now, because they're born in a time when there's so many gadgets. I'm like, how do they get to understand how phones work so quickly? But guess what? They have little tablets at school that they learn on, that they use to practice certain skills. So, of course, that mental acuity to understand like technology is definitely
Hmm.
different from me. I have a
Yeah.
problem with it. Like, no, but that's the world that they're growing up in. It's got technology everywhere. So, as much as I struggle with it, part of me has to accept that, look, you're not living in the times where you didn't have these things. These things are now part and parcel of society. All I have to do is control what she does with it. Yes. You hear such things like cyberbullying, and you think, what? I didn't even understand what that was. And somebody explained to me it happens to kids in schools because they have mobile phones
Hmm.
and they have profiles, social media profiles, and they bully each other that way. I was like, what? Because that wasn't my experience. I didn't grow up in a time like that.
Either.
So I
Yeah.
had to be aware of. of that. And I noticed, like, my daughter will notice things like tattoos on people, because there's so many people with tattoos now. She'll go, oh, they've got a tattoo. And I'm going, you know about tattoos? Oh, yes, there's so many parents who come to pick up their kids with tattoos. I'm like, oh, okay.
Huh.
But that's new to me because I didn't grow up in a society where people had loads of tattoos. And I remember when I worked in hospital, you were not even allowed to have tattoos on your arms. If you had them, you had to cover them because the hospital bosses were like, it's unprofessional. But now when I go into the same hospital, I'm seeing tattoos on staff everywhere.
So your daughter is right. She's like she's conscious. She's paying attention. She's like tattoos, tattoos. Because maybe there's something in her that senses there didn't used to be this many tattoos on people, and she's picking it up.
And also in our family, she wouldn't see them that much. So she's probably like noticing that, oh, I'm seeing certain families with them, even though in my family, I don't really see people with them. You see? Yeah. But I also wanted to say this, that one thing I've noticed is that, yes, there's a fear of therapy, but having grown up in the church, people go to speak to church elders a lot for their problems. That's a form of talking therapy. The
Mm-hmm.
only difference is they're using a faith-based approach to your problem, a faith-based solution to your problem. So anyone who says, oh, therapy, and I think, look, if you are part of a community where you go and see an elder, where you go and see a pastor, where you go and see the priest,
Mm-hmm.
Roman Catholics, as much as the priest might not necessarily tell you what to do, but you say, oh, Father, forgive me, I did this. What you're doing is what your soul needs, which is part of therapy, to receive that, oh, it's okay. We understand. Don't be hard on yourself, without judgment. Hence, people, use all these avenues in life. But in our modern way, in our modern world, where we are very individual, that's comes with, as I said, capitalism, westernization, approach to life. I understand why therapists are there, because we are more isolated than ever.
Yeah. Yeah, well, as we close this out, Fatima, I have a question I started asking everybody, and it is, what has been your greatest breakthrough when it comes to your own mental health or your own experience with talk therapy? What's your greatest breakthrough?
Mm, great question. My greatest breakthrough was recognizing that I am an individual with an individual purpose on earth. And as I pursue that, I experience more freedom, more joy than, than when I suppress it, because I want to fit into culture, I want to fit into community. And when you look at the greatest inventors in our world right now, what sets them apart is that individual idea that they bring to the world that nobody's ever seen, and they pursue it until one day it becomes our reality. Then we're like, oh, they're so intelligent. Oh, they're so amazing. But they tell you that people said they were crazy for having those ideas. People in their community did not even acknowledge them at
Mm-hmm.
all. They were like, oh, don't be silly. Don't be crazy. Nobody's ever done that. So it takes detaching yourself from your beliefs that you were brought up with. There's some that are values. There's some beliefs that are values. You can keep those. So, for example, for me, as much as, family, community, you name it, but for me, family is still very important to me. However, I know how to pursue being an individual, but still belonging to my family. It's because I don't look to them to be the ones that give me that sense of value and worth anymore. I already have value and worth. I already belong to my family. It's just
Hmm.
that I've also got great ideas that I'm going to explore, you know. And what therapy did for me, I think it gave me this sense of self-awareness, self-acceptance. Like, look, you're not going to be the same as your siblings, even though you're born in the same house. You're not going to be the same as your neighbors, even though you grew up in the same community. Everyone is a bit of an individual to an extent. And that's okay. Don't be afraid of it. Now and again, they might not accept you, but do you accept yourself? Do you believe in your idea? Do you believe that something inside you is telling you that right now your life is in what it should be? And there's a call to that, to pursue what's calling you, to say, I'm not content, or I'm not so fulfilled, or okay, I'm a bit isolated, but I'm around community. What's going on? As you pursue that, there's some beautiful answers that you just unravel. They just come to you. And there's the word that comes to me is like there's a greater freedom that comes with that, a greater joy, greater peace. And that's what therapy did for me. I'm a happier person because of it. And I can be with my family, because my family are probably the most important people to me. I can be around them, have a different idea to them, and never be offended when they don't agree with me.
Hmm.
Because therapy taught me your idea is your idea. If it's not harming anyone, there's nothing wrong in you pursuing it. There's nothing wrong when the family say we don't agree. They haven't seen it. You pursue it quietly. One day they will see, they'll be like, so you went on to something after all. And they may never do that, but believe in your idea because it's your idea. And I was like, okay. And that really helped me. Yeah. I
Yes,
can have
believing in your
disagreement with my
idea.
family about something, not even disagreement. Nowadays, they'll tell me, oh, I don't agree with this. And I go, interesting. Ah, I never argue because I'm not trying to convince them anymore. I just want to know what they think. But also, then it shows me what I think and what I believe in and what I want to pursue.
Yeah, you have that freedom. You
Yeah,
have that freedom.
exactly.
Well, thank you again, Fatima. This was amazing. How can people get in touch with you? Because you do life coaching as well, in addition to a nurse. Am I correct?
Yes, I do. I do life coaching and as well as nursing. So it's just, sending me a DM because I don't always open my calendar depending on what I'm doing because I also do childcare. This person takes up my time. Yes. But if anyone, so what I do a lot in self-love because that's one of the things that therapy helped me in was
Mhm.
really working on me loving myself, which also means when you love yourself, you believe in yourself, you pursue the dreams that you have with that self-belief that even if someone doesn't agree with you, because you're coming from a place of self-love, you believe in your dream and you continue and you carry on with it. So that's what I coach people on. And also when you're dealing with family, you struggle with things like being a bit codependent, people pleasing. So those are the things that I had to sort of shed. I had to see the patterns of my people pleasing tendencies and how they stopped me living my dream, pursuing what I should be pursuing, how codependency makes me think we should all think the same way or do the same things, even though I have an individual vision, dream, and desire. So I deal with that in helping people understand that, like see that pattern and how to sort of like break yourself out of it, but still belonging to your family. Yes. So that's how people can find me.
Amazing. So you all heard it right here on Heart to Heart. Make sure you send Fatima DM right here on Instagram, Fatima Denga. You'll find her. I'll tag her in this video. And this has been a beautiful conversation. Thank you again. Until next time.
Okay, then
Bye.
bye.